Hi there, Dr. Gary on the road. We are dental practice brokers nationwide. So today's topic is case study. Specialist buying GP record sale. Unaware of the coming hurricane they're about to encounter due to poor planning. So we're going to talk about this. This deal already occurred a few months ago. Anyway, we're now in 28 states. We just entered the state of Ohio, so really excited about that. And moving forward, as you know, we have 10 employees, including 2 CPA accountants. We're one of the few brokers that has accountants on staff. And these are trained and seasoned accountants. Been with me for 9 years. Another one has been with me when I was a dentist for like 30 years. You can now reach us from about 8 a.m. in the morning, East Coast time, till 9:30 p.m. East Coast. So just give us a ring. We'll get on top of everything and try to assist you. Our phone number is 201-663-0935. And our the other number we have, our website is dentalpracticeguide.com or nationwidedentalpracticebrokers.com. So give us a ring. We'll be happy to help you, and we'll get on top of everything for you. Okay? So let's proceed forward. Also, if you're going to be selling to, or you think a DSO because you're larger, like over 900, a million, have multi-ops, give us a call too, because they'll often pay our commission, so there'll be no commission to you. And sometimes we can get your legal fees, many times get your legal fees reimbursed. So all of this comes into play, and it works out very well. We've done this a number of times. And if you want an appraisal, call us too, because we can give you a short-term appraisal or full-blown appraisal, whatever you need. And we can do a complimentary appraisal. So what do we have here? We have a specialist that wanted to buy a GP's practice. Now, the specialist was more interested in the space rather than the GP practice. It was really the space. So the specialist thought, well, I'll buy the practice and I'll just sell off the records, the private GP records. I'll make a little money from that, but I really want the space. That's my big intention. So I get this call like a week before closing. We may need a little guidance here. How's this going to work? I said, when's closing? He said, oh, it's next week. I said, next week? Well, wait a minute now. What are you going to do the day after closing? These are all the problems. We're used to doing this. We're used to chaos, but this is going to be chaos. It's poor planning, and there's going to be a hurricane coming. We'll get through it, but, giving us a week, it's crazy. They want us to sell the charts and also handle this transition. The first thing I said, you're going to close on a Tuesday, let's say. Wednesday morning, the practice is yours. I realize you're only buying records, but you're taking over the whole office, and the phone number is going to ring Wednesday morning. What are you going to do? You're an oral surgeon. The doctor doesn't want to stay on. The seller doesn't want to stay on. And what's going to happen to all the staff? Staff are in high demand now. You're just going to let the staff go, because who's ever going to buy the records want to know, will the staff or the doctor be available? If the doctor's not available, the value of the records are going to plummet. And what are you going to do on Wednesday morning when you own the practice and the phone rings and there's somebody it's a GP patient and they fractured an anterior crown? Are you going to refer that out? Are you going to treat it? And the more people you start referring out, the value of the records goes down and down and down, because the word's going to get out. And then I said, did the doctor that's selling inform the patients he's selling? Did he do anything like that? You've got to tell the patients. Are you going to inform all the patients what's happening? Or just how are you going to handle this? And they're like, well, we don't have a plan yet. I said, so you've got a hurricane that you're going to encounter, and you have no idea. So how are you going to handle this? And they said, well, we don't know. This is poor planning. You should have called us ahead of time. And then what about the cases, the work in progress? And they say, oh, don't worry. We have all those cases already. They're finishing up all the cases. And I said, well, what about the crowns that to be inserted at a later time because they lost track of the patient? Patient disappeared, the crown's sitting on the shelf. That's still that patient's property. Who's taking all those cases? You, the specialist, are become the custodian of the records. You're the custodian of it. I know you're going to sell, but the selling doesn't happen immediately. And what about the phone number? What about the staff? What are you going to do with the patients that walk in? And you don't want anybody knowing right now that the doctor is retired because you're going to lose all those records. The patients may start going elsewhere. So you've got to do this rapidly. Well, at least that the practice is still available, and the doctor can at least, maintain the records, and so maintain the patient goodwill, and let the patients know there's a place they're coming to. And this records weren't a low budget purchase. This was a, practice at least several $100,000. So I don't know why. I guess the seller of the office couldn't sell to somebody, and one thing led to another, and they, finally, they sold to the specialist who wanted the charts, the records. But you have to have proper planning. That's what we can do for you if we're given enough time. But you can't blindly go into this, and that's what's happening in this situation. There's so many unknowns. And now you're the custodian of the charts. What if the patient doesn't want to go there? You're responsible for those records. You have to forward them to everybody else. And then you're in an area, can we actually sell those records? I don't know. And what if they want the doctor to work, and this doctor, the seller, the GP, who doesn't want to work anymore? That's going to plummet those the value. We'd like to sell the records in bulk and get the payment up front. But if the buyer is feels uncomfortable and has no contact with the seller whatsoever, this may not work out. So there's so much going on in this deal that, I realize some of you just think you could wing it because you've had a little experience before and you sold 4, 5, 6 of them. But there's a hurricane coming for this doctor. And they're just beginning to realize it, because I was on the phone for like 20 minutes going over the scenarios. And then I asked, well, why doesn't your present attorney prepare for this? And they're like, well, we don't know. We don't know. I said, I called one of my other attorneys, dental attorney. I said, look what's happening. He says, well, the day he closes, he's going to need either that attorney, if he knows what he's doing, that handle the transaction, or they'll need an actual dental attorney, because I don't think the other guy was an actual dental attorney. He was probably some transactional contract attorney. I don't think he knows what to do. So the dental attorney says, look, we've got to have a plan of action, and we've got to figure out how to maintain these charts, keep everything going, protect the doctor and indemnify him in whatever way we can. But he technically is becoming custodian of the records, technically bought the office. Even though he's a specialist, he's taken on the responsibility of those patients. So there's legal ramifications here. Then what about the accounts receivable and all that? I'm assuming that's already been taken care of, and the seller's going to keep his accounts receivable. Well, what if the patient walks in the oral surgeon office is going to make a payment, but you're not treating any more GP patients? How are you going to handle that payment? And what if they want to pay by credit card? It goes on and on and on and on. The hurricane this doctor is going to encounter. It's great planning. We as brokers can help you prevent this if you give us enough time. We'll set up all the attorneys. We'll be able to sell those records. Now, had I been given more time, if they engage my services, weeks and weeks, maybe a month ahead of time, I would have been trying to sell those records. So the records sell simultaneously, or even before maybe the specialist is buying the records. I don't know. I would have worked out something. I would have had all the attorneys set up also. So there's a lot to be considered here. And this is where we as professionals can help you. And when you try to do it on your own, you got a nightmare brewing, as far as I'm concerned. You got a hurricane coming up. But we're here to help you. We could take a complex situation and try to simplify it by setting up all the teams. But there's so many unknowns here and so poorly planned, they won't find out what their problems are until the day after closing. That's when it will all hit. And I don't even make that much money out of this. I really don't even want to do this deal. But I'll try to help them out wherever I can. So call us whenever you can. We're here. Get ready for the next. Those of you who are get our news, our email blast, if you sign up with us, we're sending out another email blast in January. So just be prepared for that. And watch that. Now, those of you who do not get our list, because we have like 715 buyers, if you don't get the list, because we email the list, that is a new list of sellers, we'll list all our new deals almost every month. We're trying to do that. You'll get that list automatically. So sign up with us and we'll be there for you. All right. Thank you so much. Bye.